Sickle cell disease is an enduring and often invisible health disparity in the U.S. Some doctors, nurses, teachers, and employers may have a difficult time understanding sickle cell disease and the intense pain it can cause. It is a pain that can be constant, recurrent, acute, and chronic. Sadly, it's a pain that patients never know how long it'll last, as they could be in pain for hours or even weeks. To add to the pain, healthcare providers with expertise in the treatment of sickle cell disease are in short supply, and disease-modifying treatments are still limited. Hello, my name is Atiya Leach, and I'm the Sickle Cell Program Manager at the American Red Cross. Joining me to discuss the importance of equity, advocacy, and allyship in the fight against sickle cell disease is Dr. Nadirah El Amin, a pediatric hematologist and oncologist at Children's Hospital of Richmond at VCU. Hi, Dr. El Amin, how are you?
I'm doing great. How are you?
I'm good, thank you. Thank you for joining us today.
Of course.
So some 4 and 5 patients have reported suffering through pain at home rather than going to the ER due to anxiety surrounded around potential interactions at the hospital. And I'm sure for patients with sickle cell disease, it can be extremely overwhelming or even discouraging to go to the ER, especially during a pain crisis. What are the dangers of choosing not to seek immediate medical care during a crisis?
So something important to understand about sickle cell pain is that, sometimes pain is not just pain. And so if you wait too long, you could actually be developing some of the more severe complications of sickle cell disease, like acute chest or multi-organ failure. And we don't want patients to not seek care because they are not comfortable with the medical providers that are taking care of them. But it is an unfortunate reality in America that patients with sickle cell disease are often treated differently than other patients with other diseases.
Yeah, I know we hear some stories from sickle cell warriors explaining that pain medication can sometimes be withheld from someone experiencing a crisis because the ER staff may have presumptions that the patient could be drug seeking. Do you have any recommendations on how patients and family members can advocate for the best care possible in likelihood of not being denied medical care as it relates to a pain crisis?
Absolutely. So what I think is very interesting about this phenomenon that we see with patients with sickle cell disease is that if a patient with any other chronic disease came to the ER and said, these are the medications that I take, and were able to list off the doses and how frequently they took them, they would be praised for knowing their disease very well. But unfortunately, when sickle cell disease patients go to the ER and say, these are the medications that I need to treat my pain, oftentimes they're met with skepticism, and people do not actually believe that they need the medicine that they need. They're not given the benefit of the doubt that other patients are given. Because of that, we have tried to work really hard to teach patients to be advocates for themselves, to know their disease, and to, strongly say that these are the medications that I need. But we also recognize that that's not always enough. And so one of the things that we do for a lot of our patients is to create something called pain plans that are part of the medical record that, ED physicians or whoever may be taking care of the patient can access at any time, that list clearly, here are the medications that this patient needs in order to treat their pain crisis. And that has really helped cut down on some of the barriers that these patients are up against when they go to the ED. We also, for patients who live far away and maybe going to an ED that is different from where they get their sickle cell care, we can provide letters saying that this patient has sickle cell disease, this patient has pain crises, and when they do have a pain crisis, here are the medications that they need. And lastly, I think it's always important to connect our patients to outside organizations so that they can, learn from people who have kind of been through these experiences and learn to speak up for themselves, and also have a good support network when they do run into barriers with receiving care.
That's helpful information on what you call a pain plan. I want to talk more about that, but I know that there's another type of plan, kind of like a prevention plan that a lot of patients with sickle cell disease may have set in place before they visit the ER. What could a prevention plan look like?
So we give patients what we call pain action plans or prevention plans so that they know, if I have a crisis at home or I'm having this pain at home, here's a medication that I can start with to help. And if that's not helping at home, then here's how the next medication that I can go to or the next dose that I can increase to in order to take care of my pain at home. And if that's not helping, here's the next step to add to it, other types of pain management at home. And that helps them, empower them to be able to take care of their pain at home, and then also realize, after they've tried all of these interventions, that now it's not working, it's time to go to the ER.
Yeah, and I'm sure by the time they're at the ER, they've tried all of that, and they want to have the best experience possible. So you talked about the pain plan, and even the prevention plan. Who are the people involved that help develop that plan that they can reach out to?
So in an ideal world, the people that would be involved are the people that take care of them on a daily basis, who understand their pain crises and understand the medications that work best for them. Pharmacists are involved also to help make sure that we're picking the right doses and stepping up to the right medications. Sometimes even social work and mental health practitioners are involved in case there sometimes can be other medicines that kind of hit different pain targets. So it really should be a multidisciplinary team that is involved in making these plans for these patients.
Great. So these people on this team were typically more experienced with dealing with patients with sickle cell disease or more aware of the disease. As a medical professional, who understands this disease and the impact on patients, what would you recommend for medical professionals who are not as experienced with the disease when they're trying to care for someone in the ER, experience a pain crisis or any other complication related to sickle cell?
I think I would encourage them to reach out. If they are uncertain or unfamiliar with a certain disease process, there are always people, even if it's not at your hospital, that you can reach out to kind of get some of your questions answered. I think it's also important to be proactive yourself and know that if you're uncomfortable taking care of sickle cell patients, take some courses in how to manage sickle cell pain. There are a multitude of articles that have been written directly to ED physicians and urgent care centers about how to manage sickle cell pain. So there is information out there for sure. And I would also say, listen to your patient, just like you would listen to any other patient with any other disease. If you see a patient who's in front of you and is in pain, listen to them and work with them so that you can come up with a plan that works for both of you.
That's good to know. You've mentioned, seeking additional education and listening as well, as part of kind of that empathetic process. So, going back to the medical professionals designated to help those with sickle cell disease, there's a transition period, right, that patients with sickle cell go through from childhood to adulthood. Could you talk about that?
Yes. So this transition phase is something that we have been paying a lot of attention to in recent years. We've noticed that when we look at mortality and morbidity in these patients, that this transition age period around 18 to 25 tends to come with some of the highest rates of morbidity and mortality. And it's a very concerning trend. And we're trying to understand why it's happening and the ways in which we can intervene to help these patients successfully move from being a pediatric patient to an adult patient. I think we have definitely identified some barriers, like some of the things that we've talked about, the health disparities that we see kind of tend to peak around this transition age. And in addition, we know that there aren't enough adult providers to take care of these patients. So sometimes we don't have anyone to transition them to. And that can, of course, cause or lead to more complications and things like that if they're not actually having their disease taken care of. So it's really important for patients and for parents to know that this period of time can be a very difficult one. And I think it's really important for us as medical professionals to continue to develop strategies, techniques, protocols so that we can help these patients successfully transition to adulthood. We have really extended the life of sickle cell patients over the past several decades, and I think that we need to continue to make sure that that we're taking care of these patients very well at every phase of their life.
Well, thank you for all the work that you're doing in all all the advocacy tips that you're putting out there to help those living with sickle cell disease and also help those loving someone living with sickle cell disease. So, again, thank you for your time today, and I appreciate you joining us.
Thank you so much for having me.
Thank you. So to learn more about Dr. El Amin and the work she and her colleagues are doing to support patients with sickle cell disease through the Sickle Cell Program at VCU, you can visit vcuhealth.org. And for child and family-focused health information, you may visit chrichmond.org. If you'd like to learn more about blood donations or even hosting a blood drive to help those patients with sickle cell disease, you can visit redcrossblood.org/ourblood. Thank you.